Hello and welcome. Today, we're going to go over adductor-related groin pain, which is a pretty common issue, especially for people who play sports or do a lot of movement with their legs. I'll help you understand what might be causing this pain, how you can take care of it at home, and when it might be time to check in with a healthcare provider. Whether this is a one-time thing or it keeps popping up, this video should give you a clearer picture of what to do. Let's start with the basics. What is adductor-related groin pain? Your adductor muscles run along the inner side of your thighs, and they help bring your legs together and stabilize your movements. If you play sports or are active, you may have felt some discomfort here before. These muscles are often strained or overworked during quick movements, like suddenly turning or lunging. This is why this type of pain is common in sports or activities that involve quick changes in direction. Now, let's talk about how to recognize if this pain is coming from your adductor muscles. Usually, adductor-related pain shows up on the inner thigh, near the groin. You might feel it when you try to bring your legs together or when moving side to side, both of which put pressure on the adductor muscles. To check this yourself, you can sit down, put a soft object like a pillow between your knees, and gently squeeze. If you feel pain in your inner thigh or groin area, it might be related to the adductors. Now, let's go over some things you can do to help manage this pain at home. First up, rest. This doesn't mean you need to stop all movement, but try to take a break from activities that make the pain worse. Avoid pushing through the pain. Sometimes, resting is the fastest way to get better. Next, ice. If the area is sore or swollen, applying ice can help reduce discomfort and any inflammation. Wrap an ice pack in a cloth and apply it to the area for 15 to 20 minutes a few times a day. Just be sure not to put ice directly on your skin, which can be irritating. Once you feel a bit better, adding gentle stretching can help keep the area flexible. A good stretch for this is the butterfly stretch. Sit on the floor with your feet together and your knees bent outward. Then, gently press down on your knees until you feel a stretch along the inner thigh. Hold it for a few seconds and repeat a few times. And remember, stretching shouldn't hurt, just go as far as is comfortable. If you need extra help with the pain, an over-the-counter pain reliever like ibuprofen can be useful. Follow the instructions on the package, or check with a pharmacist if you're unsure. This can help reduce pain and inflammation, which is especially helpful in the first few days. Now, all of these steps are here to help you manage the pain without avoiding movement altogether. Moving a bit within your comfort zone is actually helpful for recovery, but listen to your body and avoid anything that makes the pain worse. Of course, sometimes you might need a little extra help from a healthcare provider. Here are some signs it's time to reach out. The pain is very intense, or it's getting worse instead of better. You notice swelling, bruising, or have trouble standing or walking. Or, if you've been trying these home care tips for a couple of weeks and the pain isn't improving. If the pain keeps coming back, a healthcare provider can work with you on a personalized plan. They may even refer you to a physiotherapist, who can help with targeted exercises to strengthen the area and keep the pain from returning. So, to wrap things up, adductor-related groin pain is common, and you can often manage it yourself with some rest, ice, gentle stretching, and maybe a little pain relief. But if it's very painful, not getting better, or keeps showing up, it's a good idea to see a professional who can help guide you through next steps. Thank you for watching. I hope this video has helped you understand more about adductor-related groin pain and how to handle it. Taking care of yourself now can make a big difference in helping you recover and get back to doing what you enjoy.